evening, everyone. My name is Dr. Osinubi, Omowunmi Osinubi. And with me on the call today is Dr. Nkem Okpala from Victory Medical Clinic, and Pure Chairman Black Diamond, Ms. Rachel Garcia, who is a physician assistant. So we are a three-person panel today, and we're going to be talking about Metabolic Reset 2021. With that, I'm going to start sharing my screen, and then we'll get on with the presentation. Okay, so I'm glad that you could join us today. And like I said, I'm Dr. Osinubi, and we're going to focus on what 2021 is going to look like for each and every one of us. We know that 2020 has been a difficult year, the year of the pandemic. But before I go ahead and talk about, what we've seen this year, I just want to give you a little bit of background about myself. I have been practicing medicine for more than 20 years. I'm board certified in occupational and environmental medicine. I'm also board certified in functional medicine. My day-to-day, I take care of people who've deployed overseas for combat with all manner of chronic ailments that no one can figure out what's going on with them. I'm also a clinical professor of occupational and environmental medicine, and hold certification in other aspects as well, including disability medicine. So my interest really is looking at the exposure that we have with regards to the virus, the coronavirus pandemic, and how that interacts with the host factors. And that's why we're in the current predicament where we're in now. So in terms of what's been happening in this year of 2020, when we turned the leaf over to this year, we did not know what it had in stock for us. We were in for a huge surprise and a rude shock. And it has ended our way of life the way that we used to know it. In a survey of about 10,000 people, almost 90% said that the impact, coronavirus has impacted their daily life, either on a moderately or extremely severe, to a high or extreme extent. Okay, so this has impacted us in very serious ways. And why is that? We know the virus is a highly infectious, multi-systemic inflammatory disease. There's a high risk of serious disease and death. But why is that? Because it affects pretty much every part of the body. We do not have effective treatment to date. We know that there has been some controversy with hydroxychloroquine. It's helped some people, I have to say. There is a doctor that I know that has treated more than 1,000 people. I see other people jumping in with their cameras, so I'm just going to pause for a minute and make sure that nobody else is able to share their camera. So basically what we're saying is that we don't really have effective treatment for the virus. And we know that there are considerations for the vaccine. They've already started giving the vaccines. What we're also learning is there are adverse reactions to the vaccine. In fact, in England, 2 people were critically ill after receiving the coronavirus vaccine. I'm not saying you should or should not take the vaccine, but you should be informed about what's going on. In America, when they've started to give the vaccine, what are they seeing? Some cases of Bell's palsy, which is an autoimmune reaction. Okay, so as the way that things stands right now, it still remains a high dread disease. We still continue to social distance and isolation continues. So when coronavirus hit, we were told, who are the people that are at high risk of this disease? There's a litany of a long list of chronic ailments. Everyone everywhere knows at least someone who is at high risk or has been impacted by this disease. So no wonder we're all very concerned about it, right? That concern is understandable. But what your doctor hasn't told you, probably, is that It's not that long litany of these of chronic ailments that's the real problem. 5 main conditions constitute 90% of those people who end up in the hospital with severe COVID-19 disease. 5 conditions. If you have one of these conditions, hypertension, obesity, chronic lung disease, diabetes, cardiovascular disease, 90% of those who were hospitalized have at least one or more of these conditions. And these are conditions that are everyday chronic ailments that we live with in America and also in other parts of the world. So what about death, right? Because why is this a dreaded disease? We don't fear the regular flu as much as we fear COVID-19 because it's a rapidly progressive, deadly disease. So let's look at those people who have died from the disease. The top underlying health conditions in those who died from this disease were hypertension. Almost 60% had hypertension. Diabetes, almost 40%. This is in Louisiana. I took a couple of states, right? This is in Louisiana where they had a lot of deaths. Of course, we have a lot of ethnic minorities who have these kinds of underlying chronic illnesses, chronic disease, chronic kidney disease, obesity. These are the underlying chronic conditions that are contributing to death from coronavirus disease. Let's look at New York. Similarly, hypertension, diabetes, hyperlipidemia, that's abnormal blood lipids, high cholesterol, high triglycerides, and coronary artery disease. So while we're thinking about COVID-19 as a viral disease, I think we should start to think about it a little bit differently. It is a rapidly progressive, fatal cardiometabolic disease that's triggered by the SARS-CoV-2 virus. Don't just take my word for it. The CDC, the Center for Disease Control, has said that those people who are morbidly obese or have obesity as a medical condition have higher risks of dying from COVID-19. And we know that obesity rate in our country is about, more than 4 in 10 people are obese, and more than 1 in 6 children are obese. And in Mississippi, for example, 40% of people who died from COVID-19 were obese. So when you see a pattern like that, when you see the virus affecting those people who have cardiometabolic issues, and you see obesity, we should start to think about pattern recognition. What are the similarities? What ties these two together? What is the root cause? Root cause medicine is something that I specialize in, trying to understand. If you ask why 7 times, you will probably get to the root cause of any problem. So my job is to ask why. So let's look at the why of obesity, and then we'll see how that translates into why we have so many problems with COVID-19 morbidity and mortality in the United States. Well, the first thing is a dietary pattern, right? The sad American diet, calorie dense, nutrient poor, energy excess. We eat a lot more than we need. Gut dysbiosis. That means that you have abnormal bacterial patterns in your gut, right? Those things that combination would cause leaky gut. When the tight junctions of the cells don't work well, they're separated because of inflammation. All the bad stuff that's not supposed to get into your bloodstream make their way in there. And your immune cells don't know what to do with that. And so they start to put out inflammatory cytokines. Well, part of the body's response to these inflammatory cytokines is to put down fat cells in your abdominal section to protect yourself, it's supposed to be a protective mechanism. And so once you have leaky gut, you have the tendency to have deposition of fat cells around your abdomen. And those fat cells are quite wicked, because they then put out these inflammatory cytokines, which then get into the bloodstream and then cause havoc in the blood vessels. They travel to the brain, cause neuroinflammation. Now, the brain is the master control of the body. So if it causes neuroinflammation in the brain, then you get your hormones are out of whack, and then it becomes a vicious cycle. It affects the liver, it affects your muscles, it affects your pancreas. When it affects your pancreas, you have something called insulin resistance. That is how people develop diabetes, right? All of that would affect your nerve cells. People who have diabetes, because of the, all of the inflammatory cytokines, develop what we call peripheral neuropathy, or inflammation of their nerves. All of that in total is what causes this chronic metabolic syndrome that we experience and manifest in different types of ailments. With the coronavirus illness, part of the issue is that you have leaky cell membranes in the lungs, and that causes the cytokine storm, which is similar to what happens in the body, starting from the gastrointestinal tract. And remember, when you breathe in a virus, some of it gets swallowed and it gets into your gastrointestinal tract as well. So if you already have leaky gut, if you already have dysbiosis, you're in really bad shape by the time the virus hits. And the research has shown that these, the cytokines imbalance, the pro-inflammatory cytokines, is the root cause of most of the chronic inflammatory conditions in the body. All right. So what is it that your doctor has not told you yet? Because that was one of the things I promised we would share with you on this presentation. Well, the research is coming out now, and it's compelling. They are saying the gut microbiome is an under-recognized contributor to the COVID-19 pandemic. Has your doctor talked to you about gut health if you want to keep yourself healthy, if you want to keep yourself safe from the pandemic? Metabolic syndrome and COVID-19, that the interactions between the endocrine system, the immune system, and your blood vessels is really what shapes the clinical course of the virus. They probably haven't told you. We know that diabetes predisposes to the virus, but those who succumb to the virus and are fortunate to recover may end up getting diabetes from the virus because of the impact it has had on their pancreas and causing damage in that area. They probably also haven't told you that metabolic syndrome and COVID-19 are so interrelated. They're now saying, well, could diet be the key? One other area that is so important is the role of your mitochondria. The mitochondria is the power cell in the body. If you have tip-top shape mitochondria, you have enough energy, and your cells are able to better withstand, your immune cells are able to function much better. But if you have mitochondrial dysfunction, or your mitochondria is kind of sick, it would be very tough for you to withstand. And that's why as we age, our mitochondrial function decreases, unfortunately. And so for us to be in tip-top shape to be able to withstand the virus, we need to be able to factor all of this into consideration. So there is some good news there. We've had a very tough year, but there is some good news because there's something we can actually do about this. There isn't much that we can do about the virus itself, but there is something that we as the host can do about our bodies, what we can do to withstand, right? So we talked about metabolic syndrome. What does that mean? All these bad things that are on the screen. I'm not going to read all of that to you because, it's a lot to kind of take in. But, you're probably asking yourself, how do I know that I have this, right? There's no way you can look in your bone and say, oh, I have osteoporosis, other than you've done the test, or you can't tell whether or not you have oxidative stress going on in your body. But how do you know if you have metabolic syndrome? Well, if your waist circumference, if you're a man, is more than 40 inches, or for women greater than 35 inches, If your blood pressure is more than 130/85, we used to be told in medical school that if you were 140/90, that's just when you reached hypertension. As a matter of fact, the numbers now is that you shouldn't be more than 120/80, to be optimal health. So if your blood pressure is already over 130/85, you got chronic inflammation going on there. If your fasting blood sugar is more than 100 milligrams per deciliter, and if you have high triglycerides or low high density lipoprotein cholesterol, right? Those are the qualifications for metabolic syndrome. And many of us in America have that situation going on. So what are the illnesses that are related to obesity and metabolic syndrome? Well, you have the cardiometabolic ones, right? The insulin resistance, which is your pre-diabetes, the type 2 diabetes, fatty liver. Fatty liver used to be just because of alcohol. Now, most fatty liver is not because of alcohol. I'm not saying you should be drinking alcohol, but most of it now is because of dietary factors, atherosclerosis, hypertension, and stroke. So that's on one side. On the other side, chronic diseases that we do not want to have. It's the cancers, the sleep apnea, the neurodegeneration, which we're thinking about, things like Parkinson's and Alzheimer's disease, So all of those together are metabolic disease clusters that is really putting us in harm's way chronically. And then lay on coronavirus on top of it, then there's a rapid acceleration and a progression. Well, can we continue to ignore it? Let's even say there was no COVID. Can we continue on this path of chronic cardiometabolic disease clusters? No. The lifetime cost of obesity is about $93,000 per person. $93,000 per person is the lifetime cost for obesity. So anything that we can do to resolve this issue is well worth our while and well worth our resources. So what is my conclusion? Metabolic syndrome is the root cause of most chronic illnesses in Americans. What can we do about that? Well, I have a little mnemonic for you. Sugar madness, right? The cause is sugar, not just sugar, but all of the manufactured food that's in our food supply, right? Metabolic syndrome, addictive potential of sugar, all of those lead into disordered fat storage. And this one says you wouldn't eat 22 packs of sugar. Why are you drinking them? The soft drinks that we've been sold, the fruit juices that were sold that are healthy, they have so much sugar that it is upending our metabolism. But not all hope is lost. What can we do about it? Well, we can start with nutrition. And we're going to hear more from my colleagues that are going to talk about that. Our environment is terribly polluted. Air pollution. Our food is polluted with pesticides, plasticizers, the plastic saran wrap that we put in the microwave. You'll hear that from more about that. You'll hear more about that from Rachel Garcia. Stress, right? We're stressed from morning till night, trying to figure out how we're going to feed our families with the pandemic lockdown, job losses. We're short on sleep and we don't have time to exercise. And when we exercise, we have pain, right? All of those things are potential solutions, though, if we're able to get it right. So my question to you then is, as 2021 rolls around the corner, are you going to have the usual resolution of, okay, I'm going to lose 5 pounds in 2021 and never get it done? And you're going to go into a revolution for your cardiometabolic health and say, listen, enough is enough. Let's take care of the issue. Let's address the cardiometabolic issues that are causing the problems. So what we are going to, solutions we're going to offer to you today are ways in which you can reset your metabolism so that you can stop the yo-yo dieting. That way you can feel better, you can look better, and you can actually live better. We have ways in which we can empower you to do that. Now, before I turn this over to my colleague, my esteemed colleague, Dr. Nkem, Opala, who's going to give us her own personal experience as a physician. I want to say something about COVID-19 because that's what's top of our mind right now. A new study has just been released that people who are deficient in vitamin D are 4 times more likely to die from COVID-19 than those who have adequate levels of vitamin D. Now, I mentioned earlier on the controversy with hydroxychloroquine. Some have used it with success, I must say. And there is a new study that's out with another drug called ivermectin. It's an antiparasitic drug that has been shown to be helpful in some cases, but they're not using it alone. They're combining it with various nutritional supplements. What are they combining it with? Vitamin C, vitamin D, high dose, melatonin, zinc, and then they're adding aspirin to that. So I want to let you know that the medical community is now wising up to the fact that part of the reason why we are so sick is because we are deficient in nutrients that help our immune system function optimally. With that, now I'm going to stop sharing my screen and I'm going to bring up Dr. Nkem Opala, who is the medical director of Victory Medical Clinic. She's a Pure Sapphire executive, and she's going to share with us her experience with Pure and how she's used this, this system to optimize her health, the health of her family, and the health of her practice. Dr. Opala. All right, let's see if I can.
Yes, I'm unmuted now, I think.
All right.
Can you hear me?
Yes,
yes.
I can hear you.
Awesome.
What I can do to make you the only presenter. All right. Go ahead and start.
While you try to figure it out.
Yeah.
That was an awesome presentation, Dr. O. Thank you so much. I actually learned a lot. Thank you so much. Hi, everyone. Thank you for taking your time to stay with us and learn how to better your health and your family's health as well. Like Dr. O said, my name is Nkem Opala and I am married. I have 4 children between the ages of 5 and 11. And myself and my husband run our own primary care practice in the state of New Jersey. We actually have 2 offices in the state of New Jersey. Prior to that, we've worked with the VA, worked with in the private sector as well as the public sector as well. About 4 years ago, almost 5 years ago, when I had my 4th child, I was morbidly obese. I was over about 345 pounds and had tried everything. I tried every prescription weight loss pill. I tried like running from here to China. I tried changing my diet, starvation, everything. And still you lose a little bit and then gain everything back. And I was really desperate because we started our primary care office and I was seeing all these patients and telling them, you know what? I know the importance of getting healthy. I know that if you get healthy and take care of yourself, you're not going to end up on prescription medication. And of course, most of them were looking at me and I said, you are also obese. What are you telling us to do and why can't you do it yourself? Desperately, I ran to my father and I prayed. I was like, if you tell me what to do, if you just give me a way out, I would share this with as many people as I can. And a stranger told me about the principle of cleansing, balancing, and building your body. And I did that and lost over 150 pounds. And use it in my practice, started putting this in my system, my children, my husband, my mother, family members, and saw a world of difference. So that was when I brought it into my practice after I saw it work with me. And I was very curious. I was like, why is this working? Why is prescription medication that we were so well versed in as physicians? Why is pharmacology not doing what it's doing? Why is it food? Why is it plant-based supplementation that is making all the difference? And I got into this whole world of the gut microbiome, the whole world of nutrition, plant-based supplementation. And it was interesting and it blew my mind. And every single day being on this has absolutely changed our lives. So why do I do this? Because people need to know that they have options, right? We see people start on one prescription medication and end up on 50 medication. That's because your normal physiology is pulling your whole system to the right, and the prescription medication is trying to take it the opposite way. Now, with that comes adverse effects, right? Because the medication doesn't actually really help your body work the normal way. It actually tries, it's kind of like a band-aid, right? Your body needs essential nutrition on a daily basis. You're not deficient in hydrochlorothiazide, you're not deficient in lisinopril, deficient in nutrition. So offering my patients those choices and letting them know that they can actually put whole raw nutrition in their system, and it actually start to make them feel better, help them wean them off prescription medication, and actually be prescription free, which we do absolutely well in our practice on a daily basis. So I am really very encouraged with what Dr. O said about the gut microbiome, about the brain immune gut connection, about what COVID and the weight obesity is actually doing, especially in African Americans. What we are seeing, especially in our patients in the hospital, is African Americans, one, right? High blood pressure, obesity, we're actually more predisposed to it genetically. And then we actually see that those patients that have, especially those two, diabetes, hypertension, and obesity, and have COVID-19, tend not to actually leave the hospital alive, right? Because it's just a double whammy. The metabolic syndrome that Dr. O was talking about is something that we actually have to avoid. And teaching your body, telling your body, telling people how to actually take care of themselves with this is actually going to help preserve our lifespan, right, and longevity as well. So that is why I'm so excited that we're able to offer this to our patients. We do this on a prophylactic and therapeutic basis as well. So let me say, for example, a patient comes in and has high blood pressure and is on 3 medications. So once they're on 3 medications, we know that's resistant hypertension. Something is wrong. And I love the question, why? Why do you have high blood pressure? Right? It's not just you have high blood pressure. Why? What is wrong? What is going on in your immune system? What is going on in your gut microbiome that is making you so inflamed that you have to end up on 3 prescription medications? And most of these patients actually have an etiology for the high blood pressure. Once we deal with that etiology, we find out that we can wean these patients off with nutrition and supplementation. Now, some people say, oh, I'm on organic nutrition, I eat well. And I'm like, it's not enough. And food is not the same as it was a couple years ago, where our soil was rich in sulfur, right? Our soil was rich in all this nutrition that we actually need. Now, an apple a day can't keep me away now. It's about 9 apples a day. How many people can eat 9 apples a day, right? So all those things are necessary for you to find out, why am I sick? Why am I having this problem? And of course, investigation comes in. So having a physician that actually checks, does multiple tests, right? Functional tests to help find out why you're sick. Then slowly weaning them off medication. My joy is when I see them weaned off medication, right? And someone that was on 10 medications is now down to 5. For me, even when they come down to 9 and slowly go to 8 and then eventually none, that is my joy in medicine. I tell my husband that if I did not like just the joy of medicine and helping people get better, I would have left medicine a long time ago, and I've just been sharing pure. That's all I would have been doing. But I know God actually put us here to be a light, and that is why we do this. So a quick testimony about myself, apart from the weight loss. A couple months ago, I was actually, I came back from Virginia. I went to see my sister, and I came back and I did what I normally do in the house. I cleaned up the house and I cooked for the whole week. And the next day I woke up and it was Sabbath, and I was like, I'm so tired. I'm usually not this tired, because of course I cleanse, balance, build on a daily basis, thank God. But I couldn't move, and my kids were like, why are you sitting on the chair? What is wrong with you? And I didn't know. I was just extremely tired. And I felt maybe it was the stress I put on myself. I just drove 5 hours and I came and cleaned the whole house, and I cooked for like 8 people in the house. And I was like, but I do that. Why is this different? And I said, I just put on my mask and I started distancing myself from my family, because I didn't know, right? Especially in this era of COVID-19. And I tested myself the next day and I was positive for COVID-19. And I was like, but I don't feel sick. I just feel tired. And I said, you know what? I already live on a detox lifestyle because we have the 28 detox in Pure. I live on a detox lifestyle. I tripled up my mangosteen, which is an anti-inflammatory, right? And Rachel is going to talk more about that. Tripled up my mangosteen, tripled up my noni to help heal my gut, tripled my probiotics. I started taking about 48 billion CFU of probiotics. Guys, I was still able to go to work. I was still able to exercise 1 hour a day for 6 days. I wasn't just seeing live patients. I was just seeing them on telemedicine. I was still myself, but just with a positive test, right? And my staff was like, what the heck? How are you able to do this? How are you able to function? And I'm so grateful for this philosophy of cleansing, balancing, and building. It just did not stop my life. Now, the question is not, are you going to avoid getting COVID-19? No, but the question is, when you get COVID-19, if you get COVID-19, what are you going to do? Are you ready? Is your immune system ready to deal with what comes with COVID-19? Guys, in 1 week, we signed about 24 death certificates. I've never done that in my whole career, but we signed 24 death certificates. And I mean, anyone can be that statistic. Anyone can actually go from COVID-19. But because we invested in ourselves, because we said, you know what, it's worth it for us to be healthy, and teaching this to our patients. Most of our patients that had COVID-19 that we put on this program thrived and were able to stay out of the hospital. So please listen to Rachel as she comes on after me now. She's very proficient in this. I've learned a lot from her. She's been doing this for over 10 years. She's amazing. She's a weird research girl. I don't really like research. I like reading, but she does a lot of research. She knows how to share this. She's been doing this for over 10 years, if I'm not wrong, Rachel. And she actually was the one that spoke to me before I actually joined this system of cleansing, balancing, and building. And for that, I am so grateful, because would I have been here if I hadn't been cleansing, balancing, and building? One day, just one day of fatigue was all I had. So it can be you as well. You can feel good and still function. The only thing is just showing a positive test. And within about 8 days, I just said, you know what the heck? I want to start seeing live patients. I hated telemedicine. I wanted to talk with my patients and like see them in person, and I tested and I was back to negative. So that was amazing. Of course, I infected my husband as well. Yay. But thank God he was also on the cleanse, balance, build system as well, and he was fine, right? We had someone die yesterday from a sudden pulmonary embolism, which is one of the things that COVID-19 does to your circulation. You start to form clots, it destroys your liver, just like what Dr. O said. Goji, oh my God, I doubled my Goji, which helps increase circulation. I started taking the energy because it has spirulina and chlorophyll, which increases circulation. Guys, please, all what we are teaching is because we sincerely care for you. Someone introduced you to this, someone invited you to this meeting because they know what this product and business has done in their lives. So please listen attentively to what Rachel has to say. And thank you so much for your time. Thank you, Rachel.
Thank you, Dr. Akpala. And it's amazing to think about. I don't know if you guys heard, she was 350 pounds when she, before her dramatic change and beginning to pour plant-based nutrition and cleanse, balance, and build. And if you really think about, you know, if you looked at the slides that Dr. Osinubi showed us and what's happening to the morbidly obese if they contract this virus, it is scary to think, Dr. Akpala, what would have happened. She's a mother of multiple children. It's very serious. And so everyone that you've heard talking about this tonight, we came into this for a variety of reasons. COVID, I think, just exponentially multiplied why we are very serious about this right now, because we are seeing what's happening and how this virus is impacting our community, but also how it's impacting us mentally. You know, people are scared. They're very, very fearful because of hearing things like 24 death certificates were signed in 1 week. And so I'm excited to share with you all tonight, and I'm going to share my screen, tell you a little bit about how I got started in this company. So none of us work for the company. Let me make that very clear. We are moms, we are wives, we are healthcare providers, and we were introduced to this company by somebody that we knew, and took a look at it, prayed about it, thought about it, and we did our due diligence. You know, all of us have been practicing medicine. I'm a physician assistant. This is really nice for me because I'm actually working with medical doctors. Both of the amazing women you've heard from are medical doctors. PAs work very hand in hand. We're physician assistants with medical doctors for our career. We practice medicine, we write prescriptions, we do surgery, but we're always working hand in hand with the doctor. So for me, this is an amazing gift to be able to work with these two amazing women. So you can see the pictures of my husband and I here on the left. We were in our mid-30s when we were introduced to Pure. We thought we were healthy. As you can see from our pictures, we probably really weren't. And we were very busy at multiple businesses. We both worked full-time jobs. We had 2 babies. And when we were introduced to Pure, our lives changed drastically. If you fast forward 10 years, you'll see the pictures on the right. So we're 10 years older, but we look 10 years younger and much healthier. And that's really what I wish for everyone. When I was practicing medicine full-time, and I will tell you right now, I walked away from doing that in January of 2020. I will never go back to writing prescriptions and cutting cancers out of people all day long when I found what I found in Pure. I went into that field because I wanted to help people, as all of us do. But when I was first introduced to this, I very quickly saw something that could change people's lives. And let me tell you why I saw that. Because in medical school, we're not taught about nutrition. We're not taught about the importance of what you put into your bodies. But my nephew, this sweet little boy, at the age of 3, had just been diagnosed with severe autism. And I have a master's degree in clinical medical sciences. So I began doing an extensive amount of research because I did not learn about autism in medical school. And I learned that 1 in 37 boys are diagnosed with it. And that's a scary statistic. When I also heard the pediatrician tell my sister, Bo will never speak. He will never have more than the mind of a 3-year-old. He will always be in diapers. This was very concerning. So because I'm a researcher, I started researching, friends. And I researched and I researched and I researched. And I found that what we put into our bodies, and maybe more importantly, what we don't eliminate from our bodies, is very important and has a drastic impact on how we function. So we got really healthy in our family. We got an organic garden. I didn't have time to juice all the vegetables from the garden, so they went bad. Then I began finding the agricultural studies that have shown what Dr. Akpala was just saying. The foods we're growing now don't even come close in nutrition to the foods that our grandparents consumed. And there's studies showing that. In this one study, it showed that if you were to get an orange, harvest an orange in 1960 and consume it, you would have to eat 8 oranges in 2010 to get the same amount of nutrition. And with those 8 oranges, you'd also get 360 calories versus the 45 you got from the 1 orange in 1960. So what's happening, friends, is we're starving. We're not eating 80 cups of spinach. We're not eating 99 ears of genetically modified corn. We're not doing that. So as a result, we're starving. And what are we doing? We're constantly looking for things to put into our bodies to fill our cells with the nutrition that we're looking for. So when you begin to understand that even buying organic, even having an organic garden, and it's snowing up there in the Northeast. I live in Florida, but you guys all have snow on the ground up there. So even if you have an organic garden, you're still in trouble. You need to be adding additional nutrition in for your cells because we can't get it from the food anymore. Okay, so you start supplementing, and most people get little to no results. You're researching, you're going to the health food store, you're asking the 18-year-old behind the counter who makes minimum wage, what's the best thing for my allergies or my diabetes or my high blood pressure, because I don't really like the pills and how they make me feel, and you get no results. So the average person who's into health and nutrition and knows a little bit about what we're talking about has their cupboards and their pantry full of all kinds of supplementation. You tried a little of this, you tried a little of that. I will tell you, I was somebody who bought my omega-3s from this company, my calcium from this company, my greens from this company. I got everything from a lot of different companies until I was introduced to Pure. And it was someone that I believed, liked, and trusted who said, Rachel, we know you're into nutrition suddenly. And it was a sudden thing. We want to get your feedback on these products. And I'm like, oh, you know, when you see 50, 60, 70 patients a day, you kind of see everything. Everybody's bringing everything into you, okay? And they have all these claims of how great it is, but I'd done my research. And I knew the importance of getting plant-based nutrition in. And when I heard that this company started, because this system of cleanse, balance, and build was used in a clinical practice for 30 years with patients. I don't know how long you've been doing what you've been doing, but I think we would all agree anybody who's been doing something for 30 years is probably pretty good at it, right? Whether they're a plumber, an electrician, whether they build pools, whether they're a doctor, if you've been doing it 30 years, you're probably pretty good at it. So in my head, I thought, 30 years using this system with patients. I can't out-research that. It's lining up with everything I know, and it's based on this fabulous book from the verse from the oldest book of wisdom. Everything we need comes from the ground to make this amazing machine run the way it's supposed to run. I know you've just heard all that these ladies have said, and it's kind of like, oh my gosh, we really are messed up. We really do need to get it together. I'm about to make it really easy for you. Pure is just an online nutrition store. That's all it is. But you won't go, there's no search engine optimization, there's no billboards, commercials, radio ads. When this company started, they said, we have 30 years of using this with patients. We have a backed up waiting list for people to get in and get on these products. We're just going to start a company where everyone can have access to it, but the only way they find out about it is word of mouth. They just took out the middleman. Okay, so somebody that I knew heard about it, told me about it, asked me to look into it, and I said, I want every single one of these products. I got involved because I was tired of doing the research. I was tired of going to, do you see all the research these ladies did for us tonight? Dr. Osinubi gave us a tremendous amount of research. That takes a lot of time. To do the research takes time. To listen to it takes time. And most people are like, I have no time for this, right? You've got kids, you've got husband, you've got all kinds of things going on. I was tired of doing the research. And so when I saw this, I said, I'm in, give me everything they have. I know they're speaking truth because I've been doing my own research on my nephew's autism. I know this is true. I'm here today, 12 years later, because of the very real results. Because I've seen tens of thousands of people throw prescription medications in the trash. I don't know if that's going to happen for you. I'm not going to make claims. But do you struggle with high cholesterol, blood pressure, diabetes? Are you pre-diabetic? Do you have joint pain? Are you morbidly obese? You need to do something, friends. You need to do something. I think what Dr. Osinubi has just laid out for us and Dr. Akpala, you know you need to do something. What are you going to do? Okay, I'm going to make it really easy for you. First, I want to just briefly, I'm going to briefly break this down for you. This is our Core Plus philosophy. It circles around 3 pillars of health: cleanse, balance, build. We cleanse the oil out of our cars every 5,000 miles. Down here in Florida, we cleanse our air conditioning filters every year because if we don't, they don't work. But we don't think about our house. Our home is our body. Our soul lives in our body our whole life. You have to cleanse it. I've had people say, well, Rachel, I poop every day, I'm fine. No, that is one way that you cleanse. There are 7 eliminatory organs that we were given: our lungs, our liver, our skin, our lymphatic system, kidneys, blood, and intestines. Our products cleanse the junk out of all of those eliminatory organs. If those organs are backed up from the pesticides, herbicides, fungicides, plastic from the plastic water bottles and Tupperware containers and saran wrap that you've used for decades, then they can't even absorb the good stuff that you put in. We got to cleanse it out. Then we balance out your pH and your hormone levels with plant-based nutrition. I always talk about this book, largest human population study ever done. They wanted to know, why do some people live to their hundreds with no health issues at all, and then others are going around Disney World in wheelchairs at the age of 45? What is the difference? Largest human population study ever done. Came down to 3 things. It says it on the back of the book: breakfast, lunch, and dinner. One group ate plants, and more plants. The other group ate meat, dairy, sugar, soda, coffee, bread, sweets. I don't have to tell you which group was the healthy group because you already know. Another book I often reference, Chris Wark wrote, Chris Beat Cancer. This is all about getting your body alkaline, pouring plant-based nutrition in, and allowing it to fend off and fight off anything that comes to harm it. And we do that with our cleanse, balance, and build philosophy. I'm not going to go through all these products. We have a very short video that someone can direct you to. I'll show you where it is, in which I go into detail on each of these products. But this is the core of what this company offers. You heard the women tonight mentioning a few of these superfruits. Our superfruits are wildly harvested. They've been used for centuries in the areas where they're grown. Goji is known as a happy berry from the Himalayan mountains. It's huge for circulation. The clinical studies that have been done in the US and published over the last multiple decades for every single one of these superfruits are powerful. If you're into research, we can send the superfruits video to you where I go through some of those clinical studies, and you will end up saying, I need every single one of those. Whether you have a history of cancer, your family has a history of cancer, you struggle with inflammation, you're trying to beat COVID, you're trying to boost your immune system, you're trying to get your blood circulating, you struggle with depression, you struggle with arthritis, you need the Core Plus and the superfruits. at a bare minimum, okay? So I throw this slide up here only because I want you to see kind of the ingredients in our product. So a lot of people say, well, we have a really good shake, a really good vegan shake, but then you turn the bottle over and you look at it and you know what this is for the people who know what they're looking for. You know what you're looking for and you're like, yeah, that's junk, that's junk, that's junk. Not with Pure. Everything we have is clean. There is no soy, there is no gluten, there is no dairy, there are no artificial flavors or preservatives, there are no sweeteners or fillers. It is all pure, clean nutrition. It's the best vegan shake you'll find on the planet. Am I telling you to go vegan? I'm not, but I'm saying, how many plants did you consume in the last 24 hours? And maybe you're really good at it, but what about your spouse and your parents and your kids? We make it easy, friends. My kids get more nutrition in a 30-second, two 30-second slams of 2 ounces of liquid nutrition in the morning and 30 seconds at night. They get more nutrition in one day than their whole class gets in a week, because their class is eating Oreos and Doritos and gummy bears and who knows what else they're eating. Hot dogs and hamburgers and French fries. In America, one of the largest fruit groups or vegetable groups is tomatoes because of all the ketchup everybody eats. You guys, it's not a vegetable. We've got to get it from other places. So most people, when they get started with Pure, remember, it's just an online nutritional company, will pick the Core Plus or the Detox that you heard Dr. Osinubi talk about earlier, and then add on the superfruits. I say anybody over 45, you need to be on the Core Plus and the superfruits for your first 30 days. Restart, jumpstart your body. You'll figure out what you love, and then you pick and choose going forward what you cannot go without. If you struggle with pain of any kind, allergies or asthma, sulfur is probably going to be one of your best friends, but it really only works well in combination with the whole cleanse, balance, build system for the first 28 days. We're resetting your body. Then you figure out where to go from there. Maybe you're struggling with weight and you're like, I need a total reset. You need to look at our Detox Plus system. Gives you 28 days with the superfruits, walking you through exactly what to eat, what not to eat, incorporating the Core Plus and the superfruits. It's a fabulous program. Maybe you're freaking out about COVID, okay? If you're freaking out about COVID, Core Plus, superfruits, look at the immune products. I actually went and grabbed them before I came on here tonight. And I took 2 of these real quick before I started speaking because I looked up some of the research that I have from the past on our Immune 6 product. And I'm like, okay, I need to consume this right now. I'll just take 2 more. I took 2 this morning. I'm going to take 2 more. High levels of vitamin C, high levels of vitamin D, and then it also has selenium and something called inositol hexaphosphatase. I'm not going to go into it for a long time, but if you just research it and read the first couple of medical studies that pull up, multiple medical studies published on this ingredient showing prevention and sometimes reversal of cancer. Hello, that's huge. What did you hear what Dr. Osinubi said earlier about the vitamin C and the vitamin D? Massive amounts of that in this product, in our daily build, our liquid vitamin product, which everyone should be on. This is the most comprehensive liquid plant-based product you will find anywhere, and it's in your cells within 18 minutes. High levels of vitamin C, high levels of vitamin D. Another one of our products with high levels of vitamin C and D is our calcium MK, also part of the Core Plus, huge for bones, huge for building up your alkalinity. If you're acidic because you're drinking sweet tea and Coke and meats and dairies, your body's going to try to get alkaline. It's an amazing machine. It can do and be where it needs to be, but it's going to leach all the alkalinity out of your teeth and your bones. You do not want to be consuming cow's milk to get your body where it needs to be. This is all plants. Our calcium MK, if you struggle with insomnia, bleeding gums, if you struggle with bone issues, joint issues, calcium MK may be one of your favorites. But our immune products, as you see on the screen, the Immune 6, the colloidal silver, which is centuries old, is the first antiviral ever found, and it kills lots of things. So you want to be consuming this on a regular basis. You put it in your mouth, underneath your tongue, body absorbs it very quickly. You can also, we like to have it in our medicine cabinet at home. If you have a sty in your eye, if you have ear issues, burns, I used to prescribe this for burns all the time. And lastly, I looked up and found a medical study on this right before I started. This is our skin defense, hypochlorous acid. There was literally just a study published for oral maxillosurgery showing and saying why physicians should be using this in the operating room to sterilize for COVID. Go find that article. We use it in cars. We use it in our kids' backpacks. We use it to sterilize our phone. If you come in contact with someone who's been coughing a lot and you're like, oh my God, you can't spray alcohol sanitizer on your face. You can spray your face, your steering wheel with our Skin Defense. These are the immune boosting products that you should add on to your Core Plus and your Superfruits package, or grab one of our packages that have all of them together. Again, we're just an online health and wellness company, just like Amazon. We are all buying online right now. You are lying to me if you say you aren't. You go to the website, you pick out what you want to purchase, throw it in your shopping cart and check out. It's very easy. Some people, when they hear about this, are like, wait a minute. Is this like one of those things that my sister's doing? She's selling shakes or makeup or something. I have no idea what your sister's doing, but I can tell you that when I saw patients for 20 years, 60 plus patients a day, I saw everything there was to see. This is nothing like, there's nothing out there like this. Number one, it's for everyone. Okay, that's huge. It's for the dogs and the cats and the parents and the children. Number two, it's a consumable product. That's important for a number of reasons. Number three, 93% of people who purchase it once repurchase it. Why would they do that? There's no sugar in our products. They don't really taste very good. Why would 93% repurchase? Friends, because it works. Because you can tell when you take it, you can tell when you don't. Do you struggle with pooping? Do you struggle with energy? Do you struggle with sleep? Do you struggle with pain? Do you struggle with mood? Do you struggle losing weight? Those are 6 things that we often see results in the first 28 days of consuming the Core Plus products. It just gets better and better after the first 28 days. They have a 30-day satisfaction guarantee. The company's based in Texas. I want to tell you a little bit about the company. They started in 2008. We're in 10 different countries now, I believe. See Nigeria, Ghana, Australia, South Korea. So if you have family in these areas, they can be purchasing and they can purchase from you online. You just send them the link, they can purchase from you. The company has decided that they're not going to spread by anything other than word of mouth. So every day we have consumers join, people who just purchase products, and then we have people who joined as consumers and say, oh my gosh, I have to share this, like you heard Dr. Akpala's story. Then we have people join and say, I know this is good, I'm going to share it right from the get-go. One of our owners is Phil Knight. He is the author of this book, Shoe Dog, founder of the largest shoe company in the world. Big deal to partner with people who have big pockets, deep pockets, especially in times like this. And I will tell you, we have an essential business here, friends. If you're looking for an additional stream of income, you don't need to look any further. This is an essential business. It's only grown in the last year and it's only going to continue to grow because people have realized what I put into my body matters and it's wise to have multiple streams of income. We have multiple medical doctors on our advisory panel. Many of our products from the physician's desk reference. Dr. Nkam Akpala, Dr. Osinubi, myself, we've all used the PDR to write prescriptions for a very long time. Pure Life Changers is where you can go to hear me speaking a little bit slower and get more information on the products as well as follow real stories. Asked to be added to our, I call it TripAdvisor for Pure, our Changing Lives with Pure Facebook page, where there are thousands upon thousands of testimonies. You can use the search box, type in ADHD, type in migraines. What happened for someone else may not happen for you, but it's nice to hear other people's reactions and results and what they did and what they used. You can go right now to livepure.com. Right now, go type it in, livepure.com. Start shopping. Go to purelifechangers.com to learn a little bit more about the products that we have. And as I wrap it up, I'll tell you, you have 3 ways to join. If you go to livepure.com and you start shopping, you can pay full price for products. But friends, why would you do that? If you can get 25% off, why would you not get 25% off? If you give them your email address, at checkout, it'll ask you, do you want to be a preferred customer? Yes. Give me your email address and get 25% off. I literally just got off the phone with a physician who runs a group home, a nursing facility of sorts down in South Florida. She gave me eight orders for 8 of the residents to order the Core Plus packages, all of them, because she knows the power and what's going to happen here for these people. They are not becoming retail customers. We're saving them 25%. We're putting them in as preferred customers. They're also going to get in the rewards program. So when they repurchase, they get 20% back in free products. It makes it cheaper than what you're buying elsewhere. And it's good and it works. Or if you're thinking now of other people you want to share it with, look at the business side of things. That's very important. Look at the business side of things. This is the time when we need to be thinking about multiple streams of income. There are people who will struggle during this time, but there are many who will thrive. Which one will you be? We are handing you on a platter health insurance and a business that's tax deductible all in one hand. The Core Plus that I've talked so much about, it's $269.95 with that 25% discount. You guys, this is a jump start for your body the first month. Okay, if you're just looking at the products, add the core plus, add the super fruits on for about $139, you're good. Okay, so you can add whatever you want. Just type it in the search box of livepure.com and you can grab whatever you want. If you're looking at the business, know you're partnering with one of the wealthiest men in the world. That's a big deal when starting a business, friends. It's one of the reasons we've been here for 12 years. And we didn't close in the first 5 years like most businesses do. All we do, there's people who have invited their friends and their family to watch this tonight who are not presenting. We present for you. We work for you. Okay, can you invite somebody to watch a presentation? We have long presentations. We have short presentations. All you do is invite somebody to watch. Tell them why you're inviting them to take a look, and when they have questions, get them back to us. There's going to be a Q&A session here with the doctors that's going to be amazing. And I will wrap up by saying, if you're thinking about the business or you have a large family, get the family package. You'll set yourself up to get 50% back on your customers' repeat orders. Basically, that just means you're going to set yourself up to earn as much as you possibly can in the first half of next year. Okay, that's basically what that means. But I came in with the family pack because it's the best bang for your buck. And I had a big family. And I was like, I want everything. Give me everything. I want it all. And meanwhile, I set myself up for the business. It's a tax write-off. And my gosh, can you believe that you can start a business here for under $3,000 and you actually get to eat it? You can start really wherever you want. The Be Healthy pack is a great pack. It's got the Core Plus, it's got the Super Fruits, it's got the immune products I talked about. The Detox Plus is another great business pack to start with. Family pack, both of these ladies that you're about to hear from again will tell you that's where they started for a number of reasons, and I'm sure they'll jump into that a little bit. So check out what you want at livepure.com, and I'm just going to tell you there is no better time than right now to change your life forever. If this is not your tool, if this is not what you choose to use to get healthier, to take yourself to the next level, to get out of debt, to get out of fear, to get out of sickness, if this isn't what you use, friends, find something. Find something. That's my plea for you. But I have a feeling that if you've been looking for better health, if you've been looking for a way out of your financial issues, this may be it. So thank you so much for inviting me on tonight. I'm going to turn it back to Dr. Osinubi. Again, you guys have these two amazing medical doctors here pouring into you. People pay money to have consults with these women, and you're getting to spend time and talk to them for free because they want to help you. So please listen to them and ask whatever questions you want. Again, think about this. If you went to the doctor because you had arthritis in your hand, you're paying money to go see the doctor. You're getting free consults with physicians right now. They're not going to go through your medical issues and tell you this and tell you that. They're not going to make claims about anything, but take advantage of this time. Okay. Thank you so much for having me on, you guys. God bless and take care. Bye-bye.
Thank you so much, Rachel. This has been amazing. You're such a wonderful leader and we're so appreciative. Thank you so much. All right. Thank you, Dr. Nkem, for sharing, your heart and your life with us. And now we are open for questions. I want to thank everyone that has been on this session with us today. Everyone has been pretty much glued to this screen, I can tell. No one has left. That's amazing. So it is time for questions. Please type your questions into this chat box and we'll fill them for you. So Dr. Nkem, feel free to come back on the screen if you'd like to, and we can do the Q&A together. Any questions, anyone? And any comments from anyone who's been on, using the Pure program? If you'd want to let us know what your experience has been, we know that. Yeah, thank you. It says great presentation. Thank you from, I believe that's Esther. Thank you very much. Yeah, if you have any questions, if you have any comments, people who have testimonies with regards to Pure, please let us know. We would like to hear. And I'll pause the recording right now, just so that